Welcome to Trailblazers with Garry, a serious but global health matters podcast. I'm your host, Garry Aslanyan. In this series, I sit down with trailblazers in global health for short face-to-face conversations, which you can listen to in audio or watch the video. It's a chance to get to know the person behind the work, hear their stories, and gain their perspectives on current global health landscape. Join me as we explore the people, places, and ideas driving global health forward. Let's get started. For this episode, I had the pleasure of sitting down with Dr. Lena Nanushyan in Yerevan, capital of Armenia. Lena is a dynamic leader and currently serves as the first Deputy Minister of Health. In our conversation, she talks about her work to strengthen tobacco control, a commitment that earned her the World No Tobacco Day Award at WHO in 2025. She also shared about Armenia's efforts to reduce high out-of-pocket health payments and how the country is moving closer to universal health coverage. Throughout our discussion, Lena emphasizes her belief that bringing together diverse perspectives and building strong multi-stakeholder collaborations is essential for lasting progress in health. I hope you enjoy this inspiring conversation. Hi everyone, it's Garry Aslanyan, and we are going to record another episode of Trailblazers with Garry. And I'm very pleased to be at the Ministry of Health of Republic of Armenia in Yerevan. And the first Deputy Minister of Health, Dr. Lena Nanushyan, has joined me for this conversation. Thank you for finding time for this conversation, Dr. Nanushyan.
Thank you for giving me such opportunity to meet you and also to talk about our health issues in our country.
Perfect. And of course, there's a lot to talk about. So let's get started. I'm really interested to know what made you choose a career in public health and also in working in public sector and in the ministry. How did you come to that? If you could share some of that. And what challenges and opportunities that brought?
I have to bring you back to 90s when I have graduated medical university, and during my studies at university we were going to different hospitals, having different trainings in medical care in different subjects, and during that time unfortunately I was observing that the hospitals were very bad condition. There were no medication, there were no money for salaries, no good quality for care. And during that time I understood that might be need in my country to have good maybe managers or policy makers that will make a change in environment that in which the healthcare services are provided. And that was one of the points I have decided to go for healthcare management and public health, taking these studies and working in that field. But another one point also that I wanted to mention, that I understood that public health gives you opportunity, and also this civil service and working in the ministry gives you opportunity to, with only change of one policy, to have impact on thousands of lives or millions of lives. In case of working as a doctor, that I had such opportunity to go for that. You will work with one patient, 10 patients, or maybe 100 patients per month. But in case of working at the public health and public service, with one decision you can impact many lives.
Right.
And this was also one of the points that motivated me to go and to have studies and to work in that Ministry of Health, at the Parliament. I have worked at Parliament, but I have also work with the same issues, healthcare issues, with different perspectives. I worked from the NGO side, I worked from the Parliament, Ministry, and UN, also international organization side, and that gives me also, experience how best different organizations can contribute to solution of the issues.
Right. So the different kind of impact you can have. I think this is a very good point, because not everyone immediately sees that way. So thanks for reiterating that point. And you have been having impact, because this year we had, you have received, unfortunately, I didn't know that. You were in Geneva and you received an award for the tobacco laws introduced in Armenia, in here. And how successful they've been in terms of smoking in public spaces, etc. Can you tell us more about that, and what were the challenges, and where are things now, and how that will contribute to public health in the country?
Thanks for this question. This is very important part of my job and also public health in Armenia. So as a public health practitioner, of course, smoking is number one priority for me and also for our ministry, because more than half of men in Armenia are smoking. And unfortunately, there are new challenges, vaping, electronic cigarettes, and our, kids and adolescents are already using all these new novel products. And for us, looking for the health issues of our population, we had a very good support coming from UN, WHO on investment case, which shows that number one priority should be smoking, tobacco control.
A special case with analysis of...
That will bring more impact, the biggest impact, on a health.
So using evidence to choose that. Okay, great.
Exactly. And the second was the salt reduction, because we are using...
Use of salt,
we are using twice more than WHO is recommending.
Really? Okay.
And so we have decided that one of our priorities should be tobacco control. And it was, of course, you do understand that it was not an easy job, especially, in Armenia, where we have industry, we have a production of tobacco, where we were in a very sensitive situation. We need to have more, economic growth, and industry could justify that more jobs will be closed after law. All those justifications, let's say, coming from the industry. But this was a primary goal for Ministry of Health, that we did understand that this will bring more impact. And usually in our public service, in the working at the Ministry of Health, you will not have very soon results. And this is very sensitive issue, You are working in a politics where you need to have quick results to show that you are working.
You made a difference.
You made a difference. You have results. You make a change. But in a public health, usually you have, results after
several years.
And it was very difficult
to convince.
Policymakers, especially government, Minister of Economy, parliamentarians, that we need to do this, because this is
how did you do it?
It was very challenging, but we used to work with our partners from WHO, from academia, from health professional associations, public health associations, and to convince, that we need this. And we brought, of course, with help of our partners, we brought some country representatives from neighboring Georgia, from other countries, who spoke with the parliamentarians, with others, that, we did it a few years ago or 10 years ago, and we haven't any reduction of economic growth. We do not have closed jobs, etc. So it was a little bit challenging, but we used to use the evidence that have been shown in other, because many countries have passed already through that.
Right.
We used how they did it and what type of results they have, how the health status improved in their populations, and it works. Of course, we have some consensus, of course, with them, for example, that not at once all the provisions will come into force, but each year we will have a new provision that will be
step
placed
by
step by step.
All right.
And one more point that I wanted to mention here, that it was not only challenging to make that change, to convince and to have the law approved, the enforcement was another challenge, and still it is a challenge. But not only by law you will have tobacco control, effective tobacco control, but also educating people, providing quitting services to those who hear that, okay, it's bad for your health, you need to quit. But what's the alternative? To provide some quitting services to people and to provide education at school, etc. So, which we are doing. But another challenge is that still every day you shouldn't think that, okay, you have approved the law, it's done,
right,
public health is done, so you need to go to do another day. No, every day you need to rework on those all issues, because the industry is working from another side.
Right.
There are new products.
You always have to be on top of it.
Yeah, and you need always to work on this issue. This is only one example of the work that we are working in the Ministry of Health.
And do you think that the public has also changed their attitude towards smoking because of that? Do you think there's been a change or a shift?
Well, usually as a public health professional, in those cases, I am looking for data.
Right.
to present that, yes, they have changed or no.
In terms of attitudes.
But the behavior change is the most difficult part.
Right.
And because we have also new products, this is also challenging. We wanted to do another study that has been done 7 years ago, before the law was approved.
To compare.
It's STEPS study. And while we will have the data, then I will certainly have an answer to your question.
So you're looking to it. That's right. That's good. Yeah, because it's very interesting to see how also things change in societal and cultural kind of aspect of how this has an impact on certain points. Yeah. Well.
Yeah, but when we are looking around, in my community with my friends, I see that many people are starting the healthy lifestyle, approach. The healthy eating is being a very, priority or prestige. The going to gyms, running, cycling, it's becoming more and more prestige, and maybe people are understanding little by little that. And also the new generation, they are more informed, and all this social media not only providing some trash information, but also providing the good information. And we need just to be in line with all these new technologies,
things that are coming up on us. And tobacco clearly continues to reinvent with new ways or new things, so they're not really sort of giving up on promoting it.
But because this is a huge money, money always matters. And in contrast with them, you do not have such money to do all this information, marketing, etc., etc. but you need also to find all those opportunities that you can use, to bring the information to our children that this is very harmful products. The only maybe product that's you are procuring and which is impacting badly on your health.
No, and I mean, it's I have experienced in these few days how it made a difference in terms of how and where people smoke, and how that is a huge achievement. I mean, thank you.
It was a honor for me to receive an award from DG, and it's also a recognition
of your work.
All the work you're doing. It's not only for the purpose, for the motivation I have in my job place, but it's also recognized.
Yeah, great.
But it's also give you, some assurance that you are in a right pathway.
Right. That what you're doing makes a difference, And you, of course, you were busy during COVID and pandemic and all of that, obviously, as every country. What has been some of the lessons, and how has the system, I mean, people speak about resilience, and is there a change in how the system is more resilient towards future pandemics? And just before we started recording, you told me that you're also looking at pushing for universal health coverage. And how do you combine these efforts together?
This is also a very important question, because during COVID we have passed not only COVID emergency, but also we had a war, and we had a war during the peak of COVID.
Right.
And lessons learned are several. And I'm trying not to forget all of them, because usually when the emergency is over, you usually forget all those lessons learned. The first one, that you should always count lessons learned. You should always remember what were the lessons learned, and to implement all those lessons learned into institutionalized system.
Okay.
Then system will be prepared for next emergency. Right. The second one is that you should be always in contact with the international partners, with the countries, with your colleagues, to receive all those information that you need to make a decision.
In advance or timely.
The international cooperation also a key. And maybe one more lessons learned, that you should develop the system in a way that it will be prepared for next pandemic, for any type of other emergency, and universal health coverage is a priority for us for that reason. Right. When the system is prepared, when the physicians and nurses are qualified, when the quality in place, when the drugs are in place, are available, when the testing system, when the laboratory quality is in place. So it means that the system is ready, and it's not only universal health coverage, but universal health coverage allows systems to be prepared for any type of disasters, emergencies, issues, etc.
So these things are intertwined. You're not even thinking of them as separate things. Exactly. Oh, this is really good, because sometimes I hear people think of, we're going to do preparedness this way and then universal health coverage that way. But what I heard from you is these are inseparable.
It's exactly because, at the primary, if you are strengthening primary healthcare, for example, we have several reforms under UHC umbrella, and one of them is the primary healthcare strengthening. If a physician, family doctor sitting at the primary healthcare setting in our polyclinic is not aware, is not qualified, doesn't know the protocols. He cannot identify which one is these diseases, what are the symptoms, and he's not having, the tools to inform or to test, have analysis. It means that you will not have any preparedness or response to any type of emergency. That's why, in my opinion, these are almost the same, concepts that are very much linked or maybe in line with each other. Another reform that we are doing is the universal health insurance system that we wanted to implement under the UHC.
Because at the moment it's a mixture of who is covered by what, right?
Yes, it's a very difficult system that we have, but the problem is that we have very high out-of-pocket payments. Financially, it is not
a burden on people.
Yes, exactly. And that's why we are now working in the government to implement this system that will allow with small payments by each month people to skip those catastrophic expenses that they have. And we're now in discussion with the government, with the parliament, and in public health you're always dealing in a politics system, and you need to work with politicians. And I'm also, as a deputy minister, also my position is a political one. And you need to all this UHC to work with all partners from the Ministry of Finance, Economy, parliamentarians. And this is very important for our country because there are some reforms, that will bring the much effect on people's life, and as you have said, will make a difference.
But I was going to make that comment and observation that, and I hope that for our listeners, those in countries who are tuning in or watching us, I've noticed with you that you have mastered, or you are very astute in terms of how to engage different parts of the government beyond health. And maybe it's a fair or not. In a short period I've known you before, in this conversation we're having, I think that's your strength in terms of how to.
It might be.
Yeah, it might be. So I think I've noticed that. So it's a very interesting observation. It's very useful for others to also think about it, because we in health sometimes don't think of how to work with other sectors.
Well, health, as WHO said, as we say, health is in all policies. And to make any change, you need to work with all partners. And with the Ministry of Finance, you need to talk with numbers, calculations, financial, taxes, as you have said, tax collection, etc. With Ministry of Economy, you should show that, okay, if not tobacco, then they can grow other products that can be, purchased with and will bring some economic growth, etc. So, with each partner, and communication as a public health professional, you need to have also communication skills, and also bring always, this is my, principle, that you need always to talk with the numbers that are evidence-based, and that will show that it's more a professional talk. When you have numbers, it's more, base for convincing, for showing, because many people, unfortunately, during this year, I've met many decision makers, colleagues, etc., who are speaking without any data, without any, just speaking,
anecdotally.
Unfortunately, but I'm always calling with my colleagues also that we need to have data to show. Of course, we can go do some homework to make some studies, assessment, etc., or bring some international experience data, but we need always to have data in our package to show that how it will be. And I think it always give you credit to promote the policy you are working for.
Thank you. Yeah, that's great. Any other innovative plans within public health in the country, or how you're working in different areas? And also you have a unique thing, which is a lot of the people, like in Armenia, is only a small part of the Armenians in the world. And how do you involve them? If you can reflect on those couple of issues.
Yeah, during these 30 years, our diaspora, which is huge, it's even 2 times more or maybe 3 times more than people are living in Armenia, inside Armenia. So they were helping in different areas. They helped to build American University, which is now giving many, graduates. They helped with the renovations of hospitals, with equipment, with drugs, and still they're helping. But there was one point that we thought that we're not using their capacity fully, and we started to work with them to identify who can help us with public health decision making, with health policy. And last several years, we are engaging them into the Ministry of Health work, and they're usually their position is the advisors to minister, and they're helping a lot
with different expertise.
Yes, so with for example, we have a group led by the diasporan professional on primary health care. We have a diasporan professional who is helping with the public health, especially on nutrition, on breastfeeding, on healthy food. So we have different people who are coming sometimes online, sometimes coming to here, sitting in this room, and also helping us to make decisions on specific areas. And this is also, this is a strength that they have, and they are using their knowledge, experience in other countries, helping to build in public health in US, in France, in Russia, in other countries, and we are trying to use also their strength and knowledge in Armenia, because they have much more experience working in other countries. They have many lessons learned in their
bigger countries, and sometimes information, data that they've already tested something somewhere else, so that's great. Now, global health in general this year, 2025, has been going through some interesting changes. So I'm wondering, you've observing, and of course, Armenia is not immune to that, and you're part of it. If you were to give one aspect of global health that you think how we approach as an international global community, how we approach these issues, what will be that one aspect that you would want to see changed or to see it differently?
The challenges now that we have faced in different areas, of course, force me to focus on one thing, that we need more stronger public health voice. That public health professionals, through international multilateral organizations like WHO, other organizations like that we have in the field that working, that can, join all voices, that we need to join and have more stronger voice, which will help, even in countries like it will help also for the Ministry of Health of officials in Armenia, in other countries, to promote the policies at the country level. It's not the matter only on international level, but at the country level. When we will have a more stronger public health, voice, it will be a very big help for me to promote any public health. It would be matter on smoking, on UHC, or any other issue. It will be helpful for me also to promote those ideas in my country. And I think we need to use all those, capacities that we have in many countries, these public health institutions, the organizations like WHO, to gather together and speaking with one voice.
Okay.
And
more solidarity of public health.
Yeah. And I think it will bring more impacts on the decisions we are making at the country level. Okay,
that's a good one. So thank you very much for this great conversation. I learned a lot. Our listeners, I've been speaking to Dr. Lena Nanushyan, the first Deputy Minister of Health of the Republic of Armenia. We hope that you enjoyed our conversation.
Thank you. It was really very interesting. Thank you.
Thank you. Thank you for joining me for this episode of Trailblazers with Garry, brought to you by the Global Health Matters podcast. The audio and video versions of this episode are available wherever you get your podcasts. Be sure to visit the Global Health Matters webpage for more information about my guest and this series.